Okay, so most of you are familiar with HIP-Cuyahoga, but just a brief overview of our vision. We are a consortium that's committed to a vision where Cuyahoga County is a place where all residents live, work, learn, and play in safe, healthy, sustainable, and prosperous communities. And our mission is to inspire, influence, and advance policy, environmental, and lifestyle changes that foster health and wellness for everyone who lives, works, learns, and plays here in Cuyahoga County. So our approach is one of collective impact, and that's a multi-sector approach to addressing difficult social issues in a structured way, and it includes a common agenda, and for us, that really is around equity. And the heart of collective impact for many movements is equity, but that's certainly the case for us here at HIP-Cuyahoga. We also value, as a part of collective impact, shared measurement, mutually reinforcing activities, continuous communication, and backbone support. And so you'll hear a little bit about each of those as we weave through each of the subcommittees and our work that's currently being done. We also strongly believe in a commitment to community engagement, which you'll hear about from different subcommittees today. And we also strongly are committed to system and policy change through health and equity in all policy. So I wanted to just spend one moment to update folks on the life expectancy maps that were released last week. So many of you are aware that Cuyahoga County Board of Health has been working on life expectancy maps and data since around 2009, and really have tried to use this local data approach to ground us in understanding what the true realities are around certain disparities and inequities in our community so that we can better address them. We can be more informed about the data and where things are moving. And recently, the Virginia Commonwealth University Center on Society and Health, in partnership with Robert Wood Johnson, put these maps together for a number of cities around the country, and ours were released on June 16th. You can see from this map that in less than 10 geographical miles, you have a life expectancy difference as high as 12 years. And you've seen in other life expectancy data maps from HIP-Cuyahoga and the Cuyahoga County Board of Health in previous years that we have these disparities that continue. And these unacceptable differences in life expectancy are yet another opportunity for us to discuss creative and innovative solutions for collaboration so that we can work together to realize, achieve health equity and realize changes for all of our community members to have opportunities to live their healthiest lives possible. So today you'll hear updates on our 4 current areas of focus. Those include eliminating structural racism, where you'll hear an update from Erika Anthony from Cleveland Neighborhood Progress. I will give you an update on the Linking Clinical and Public Health Subcommittee, and you'll hear from Dr. Shari Bolen and Rita Horwitz from Better Health Partnership on chronic disease management update. You'll also hear from Dr. Erika Trapl from the Prevention Research Center for Healthy Neighborhoods at Case Western Reserve, as well as Barb Clint from the YMCA of Greater Cleveland. Following each update, you'll hear an overview of some overarching work of the consortium from Martha Halko, who is a HIP-Cuyahoga coordinator here at our backbone organization, which is the Cuyahoga County Board of Health. You'll hear about resource and sustainability plans, communications and community engagement, shared measurement and evaluation, and our policy agenda. Followed by that, Nichelle Shaw, HIP-Cuyahoga manager, will also facilitate a question and answer session at the end of our time together today. With that, I'd like to turn it over to Erika Anthony to begin the update for the Eliminating Structural Racism Subcommittee.
Hi, good afternoon. Can everyone hear me? Well, I guess I can't hear your response, so hopefully you can hear me clearly. Thanks so much, Heidi, for giving that overview and introduction. As she said, my name is Erika Anthony. I'm the Senior Director of Advocacy, Policy, and Research at Cleveland Neighborhood Progress. Cleveland Neighborhood Progress, along with Policy Bridge, serve as the co-anchors for this committee, the Eliminating Structural Racism as a Social Determinant of Health. So today we're going to give a brief overview of what we've been up to, and then at the end, as she indicated, there will be a question and answer session. And I'll also provide my contact information if anyone wants to follow up individually with questions or comments. Next slide, please. So just to kind of start off, I just want to give a brief overview for those that may be new to HIP-Cuyahoga to let you know what the Eliminating Structural Racism Committee goals are, just to give some framing to what we've been up to. And I think just to first reference the slide that Heidi just showed as it related to life expectancy, and just the fact that this is really an unacceptable fact, not just for Cleveland and Cuyahoga County, but for our nation, which for us makes this particular subcommittee really relevant and prevalent to the sense that we need to focus our efforts on thinking about how structural racism and institutional racism really is at the root and the barriers for many racial and ethnic groups. So to start off, the 4 subcommittee goals include developing a community-level understanding of the historical forces. I think when we particularly think about Cuyahoga County and Cleveland and the health disparities that exist across the county, we realize that these issues and these problems did not just erect yesterday, last year, or in the last couple of years. There have been many factors that have led us to where we are today. Just to share a couple of statistics about sort of the state of health disparity as it relates to Cuyahoga County and some other relevant statistics. The poverty rate for whites in Cuyahoga County is 11%, and for blacks it's 31%, and for Hispanics it's 36.7%. The unemployment rate is 9.6 for whites, 21.5 for blacks, and 17.8 for Hispanics. 90% of whites have a high school diploma, which is compared to 81% of blacks and Hispanics at 69% that have a high school diploma. And lastly, it is 3 times as many likely that black babies will die compared to white babies. Those are statistics that I know don't sit well with me and are quite disturbing when you think about the racial ethnicities in our community and the disparities that exist among those that live in Cuyahoga County. In order for us to advance this work, in order for our committee to really think thoughtfully about how we move forward, we have to be cognizant of what forces have led us to where we are today. Secondly, using health equity data to illuminate how race-based policies and practice created opportunities for some and restricted policies for others and possibilities for others. Again, we're very data-focused. I think many of the subcommittees and the people that represent HIP-C have much information as it relates to anecdotal data from clients, consumers, and the people that we serve in our respective communities. But we know that that must be coupled with the data, and in order, again, to advance our agenda and to make sure that we're making an impact in our community, we have to look at the baseline data to assure that we are, in fact, looking at the right data points in order to advance our goals. Thirdly, supporting organizational, institutional, and community members to create an awareness of how and why assumptions about racial and ethnic populations can impact their thinking, feeling, and actions. Again, many of the issues that we experience when it comes to health disparities really are at the root of system and the policies that have been in place and continue to be in place. And in order to make that influential change, we need to make sure that we're not just talking to individuals, residents on a one-on-one basis, or clients or consumers, but really thinking about how organizations are contributing or helping and aiding to the health disparities in our community and really getting to the root of those. And then lastly, using an equity-focused approach to develop policies that increase social and economic opportunities for racial and ethnic minorities, change individual and organizational behaviors, and significantly improve the conditions for all people living in Cuyahoga County. Despite the policies that have been in place for centuries now, we're committed and we're excited that we have an assembly of HIP-Cuyahoga in order to really get to the root of how equity impacts every aspect of our life. I just named a couple of statistics relating to poverty and unemployment, infant mortality. So we know that the information is there, and we know that there is a quite stark disparity among these different racial groups. And in order to advance our agenda, we need to ensure that we are using an equity approach to our work. Next slide, please. So just to give an idea of some of the organizations that are represented in our subcommittee, as I noted, Cleveland Neighborhood Progress and Policy Bridge serve as the co-anchors, and we're very fortunate to have a wide array of organizations represented. Better Health of Greater Cleveland. We have various departments from Case Western Reserve University. The City of Cleveland's Planning Department is represented. The city's Department of Public Health is represented. Cleveland State University, of course, our County Board of Health, as well as our county's Health and Human Service. department, Environmental Health Watch, Metro Health, Mount Sinai Healthcare Foundation, NEON, and Strategic Solutions Partners. That's just a sampling of those that are part of the Eliminating Structural Racism Committee. We are open, and if individuals on this call today, webinar, would like to participate in our subcommittee, we welcome you. Having a wide array of perspectives is really critical as it relates to how we accomplish our work. Next slide, please. So a couple things on the horizon that we want to make sure folks on the webinar today are cognizant of, and really thinking about the basis for our committee's capacity building and efforts related to structural institutional racism over the next couple of years is what these items that are listed on your slide will help us allow us to focus and do. So the first thing is administer a readiness assessment. The readiness assessment will provide a baseline for the acquisition of future resources and the technical assistance needed to build the capacity of the HIP-Cuyahoga members. It will also allow us to enhance our abilities to design policies and implement practices that exhibit a significant level of cultural competence and racial inclusion. As the co-chairs, we are really looking forward to administering this readiness assessment and really hope that those that take this readiness assessment take it seriously and respond honestly. Speaking about race and speaking about racism is not the most comfortable conversation. It's not usually the conversation that those enjoy. But in order for us to advance more equitable policies in Cuyahoga County, we really need folks to be honest in their response, and that will allow us to really thoughtfully think through what we need to do as a committee and what we need to do as a consortium as a whole. And just so you know, when folks do in fact receive that readiness assessment, that the responses will be anonymous, and we hope that will allow folks to be more honest as it relates to their responses. The input will help us to reach our vision that Cuyahoga County is a place where all residents live, work, learn, and play in a safe and healthy, sustainable, and prosperous environment, and that our communities continue to thrive as a result of the policies that we put in place. So this will be coming out in the next couple of weeks. And as I noted before, really thinking about the organizational and the institutional level, not to say that starting at the resident level is not critical, but we want our committee made a decision that we should at least first start with those that are members of this particular consortium, and then build our basis of knowledge and understanding from there to help better guide our workflow and our capacity building. The next thing that we're excited about, and I'm sure other subcommittees are as well, is thinking about what are the policy implications for eliminating structural racism. So we are fortunate in a couple months, or a couple weeks, we'll have the opportunity to participate in a strategic communication session that will allow us to look at how eliminating structural racism is impacted, particularly as it relates to policy. And that will, again, help us to provide more of a framework as it relates to our work moving forward. So basically taking the information that we gain from the readiness assessment, and that will be used as a catalyst to think through how policy and or what policies that we should be focusing our efforts on. And then continually just thinking about how we gather research and data to support systemic change. Again, on an individual basis, there's a lot that is happening, but we know that for many of these barriers that the different racial and ethnic groups face, really is needed to be done at a system level, and we want to make sure that we have the most relevant information as it relates to how particular racial and ethnic groups are impacted as it relates to their health disparities. So that is it for me today. I apologize in advance that I can't stay on the webinar the entire time, so I'm going to go ahead and provide my contact information now. For folks that are interested in following up if they have questions that cannot be answered on the webinar today. So my phone number is 216-453-1448, and my email is eanthony@clevelandnp.org. And I thank everyone again for participating in this webinar today, and I hope you enjoy the rest of the webinar.
Thank you so much for that wonderful overview, Erika. I just want to also let participants know that there is a contact page for all today's speakers and HIP-Cuyahoga leadership. at the end of the webinar today. So this is Heidi Gullett. I am representing the Case Western Reserve University School of Medicine as a co-chair of the Linking Public Health and Clinical Care Subcommittee to give an update. My partner is Kim Foreman from Environmental Health Watch, and I will reference some of her work and her organization's work in just a moment. So our goals in our subcommittee are mainly two. The first is to create an infrastructure to facilitate coordinated community health assessments with both local health departments and hospital systems. Many of you are aware that our local hospital systems that those that are not-for-profit are required by the Internal Revenue Service to do a community health needs assessment, often affectionately known as a CHNA, every 3 years, and to craft community benefit plans that result from that. And those need to be reported to the IRS in order to maintain their tax-exempt status. You may also be aware that local health departments in the state of Ohio are required to do community health assessments, also affectionately known as CHAs, in order to get accredited by the Public Health Accreditation Board, also known as FAB. Those are usually done on a 5-year cycle. And the initial community health assessment for HIP-Cuyahoga was a part of that process for the Cuyahoga County Board of Health and our other local health departments. But our goal here was that we often see that public health and clinical care are extraordinary in our community, but not often working together around common community health priorities. And so our goal in this subcommittee was to bring these two worlds together in order to lead collaborative community health assessments together, and then ultimately to develop plans that streamline our resources and our efforts moving forward together to really get at equity, and something that we all hope will provide opportunity for everyone in our community to be healthy. The second goal was around public health and clinical care demonstration projects focused on pediatric asthma. It could have been many different chronic diseases, but we have a lot of expertise in this community around healthy environmental improvements, particularly for the home environment. And so several years ago, the decision was made to pursue some on-the-ground projects around pediatric asthma as a second level in this subcommittee to demonstrate our partnership between public health and clinical care. You heard Erika talk about a whole lot of health outcomes in our community, and I could cite many more, but I think what's really important to understand is that our county ranks in the bottom third for health outcomes according to the 2016 county health rankings. Some of those you heard cited are within short geographical distances. We have disparities in life expectancy and infant mortality, and these are unjust and avoidable, and we recognize them as inequities. And so we want to understand a little bit more about why they happen so we can creatively and collaboratively address them. This also happens in the face of extraordinary clinical care. We rank 5th in our entire state for clinical care measures, and yet we still haven't been able to address some of those disparities you heard discussed. So within our organization, we have Environmental Health Watch, and I mentioned Kim Foreman, Executive Director, who has been doing some remarkable work for many, many years, both out in the community as well as leading her organization to do policy level work as well as home remediation and everything in between. And then at the School of Medicine, we've been working on this for a couple years in a position that I have been in here at the Cuyahoga County Board of Health, working as a liaison to build partnerships between public health and clinical care. Our subcommittee membership is expansive, and when we first started, I remember sitting around the table, and it was mostly members of Cuyahoga County Board of Health, Environmental Health Watch, and a few community members who've been incredibly dedicated from the beginning of HIP-Cuyahoga. And our committee has swelled really excitingly to close to 70 individual members and many organizational members. And so as I started to reflect on these slides and putting them together, I really reflected on how many people have come to the table who care about bridging these two worlds, and that for me is really exciting. So we have multiple different sectors represented, some from not-for-profit organizations. Our 3 local health departments within our county are represented, as well as multiple health system representation and the Center for Health Affairs, which represents the hospitals in our region as well. And then we have tremendous input from local residents who are long-standing advocates and who understand why these issues really matter and bring an important community perspective to each conversation we have about these issues. So just to give you a little bit more of an update on the specific activities in our first goal, many from our committee have been involved in some activities at the state level. Despite the work we're doing here at the local level, we decided to push forward locally. We got very excited when there became a state movement around bringing these hospital and health system assessments together. And so in the fall, a number of us participated in both Population Health Advisory and Population Health Infrastructure groups that were facilitated by the Health Policy Institute of Ohio, also known as HPIO. And those are very fruitful discussions, and I really helped move things forward in the local discussion as well as the discussion at the state level. And I'm happy to say that this led to discussions within our state legislature, and there is now a bill recently signed, 390, that has now become an act, where there's a push for an assessment and ultimately a planned collaboration. So by 2017, hospitals and health departments are needing to report to the State Department of Health what they're doing with regard to these activities. But then within 2020, there's an expectation and a reporting requirement around combining our work and doing it together. This does have a lot of implications for our local community as well as communities across the state. Despite the fact that this is what we really wanted to do locally, there are some logistics issues, and that's one of the next steps that you'll see in a couple slides, is that we need to figure out how to make this happen locally. So we now know from a policy perspective that we've got folks on board and the state policy has changed, but we also want to understand what that means. And part of that is for health departments, we're going from a 5-year to a 3-year cycle. So that has implications. But I think the potential benefits of coordinating our approach and our resources with hospitals is really remarkable. So we're pleased with that. For goal number 2, Kim's Environmental Health Watch organization has really been working tirelessly on 2 specific projects. The first is BUILD. BUILD stands for Bold, Upstream, Integrated, Local, and Data-Driven, and it's really exciting that they were awarded this national grant and have received significant amount of notoriety, I would say, with regard to this initiative, because the Build Health Challenge is really innovative, and it's a very upstream-driven approach. And so their project is engaging the community in new approaches to healthy housing, and that includes a number of different things, including a number of partners. And I'd like to just highlight a few of those. In addition to Environmental Health Watch and HIP-Cuyahoga, the Cleveland Department of Public Health, the Metro Health System, as well as the Hispanic Alliance and Spanish American Community, the Cuyahoga Place Matters team, the Cleveland Building and Housing Department, and the Stockyards Clark Fulton Brooklyn Center. And the approaches to this particular project are around creating a healthy homes zone, as well as enacting prevention-based housing maintenance and determining feasibility of reimbursement for asthma home visits, which you will hear about in just a moment with the second project. So I am not at all a content expert on these, but I wanted you to know the amazing work that EHW and other partners are pursuing with regard to Build Health, and I'm very excited to hear the evaluation of this and where it goes to the next steps. The second is a CareSource pilot. It's been in process for many years and will come to fruition soon with about 100 homes involved in the first process. So it's basically looking at investing as a pediatric asthma home visit as part of the plan of care in the medical process with a physician team. So the referral will happen as part of a medical plan of care, and then there's a home assessment to ensure that a home is healthy, and if remediations need done, they are. And then ultimately looking at not just health outcomes, but cost savings, and showing this as a demonstration of public health and clinical care collaboration, really impacting important chronic disease in our community with disparate outcomes at present. And finally, you will notice if you've read our Community Health Improvement Plan, known as our CHIP, that we had a piece in there about teaching health equity. We in HIP-Cuyahoga have been fortunate to have consultants who've built a tremendous amount of capacity in our local community to understand health equity and to be able to make sure that everyone who participates in our consortium understand that as well. And they realize that that's the essence of what we're trying to achieve here. And so we began to also build this into health professions trainings, and a number of us have taught in both medical education and undergraduate as well as graduate, so medical residents, as well as faculty development for folks around our community and other health profession students. We have a brand new PA program in which we'll also be sharing the message around health equity. And we've seen an interesting shift in some organizations to commitment to really embracing an understanding of health and equity in all policy. And finally, we've been asked to represent HIP-Cuyahoga and Case Western Reserve University at 2 national conferences supported by the American Medical Association this summer, where we will be highlighting the work that HIP-Cuyahoga is doing and the commitment to teaching health equity and achieving health equity in our community as a common goal. So next steps, as I mentioned before, local coordination of assessments and improvement and benefit plans. So we really want to begin to understand what that infrastructure looks like. We've had a lot of conversations, very granular conversations about what exactly that looks like, but now that we have policy change supporting the work that we're hoping to do, we need to talk very specifically about what that actually looks like logistically. Then we would really like to evaluate that so that we can also disseminate under our understanding and lessons learned as we go through this process, as several other states have before us. We're also very excited to learn about the Healthy Homes, both the Build and the CareSource projects, following their initial pilot completions, and also some lessons learned and also quantitative evaluations. And then we're very excited, as Erika mentioned in her subcommittee, we are also excited to talk very specifically about what our policy agenda looks like. We are a subcommittee that tends to be very policy focused, and even though we have an on-the-ground project or several projects, so we really want to articulate our policy agenda very clearly and make sure it's interfacing with the other subcommittees and the overall work of HIP-Cuyahoga in general. So we're very excited about the upcoming work that we'll be doing on our policy agenda. And then finally, we really want to be able to describe and disseminate the work that we've been doing with curricula for not just health profession students, but maybe other sectors who are involved in this work as well. And that ultimately will lead to organizational capacity and workforce development. My hope is that no one graduates from medical school in this community and cannot describe and is not committed to achievement of health equity as a goal for their medical career. They may not be able to do it alone, but we certainly hope they understand it and they believe that they are a part of achieving that in their own communities. So at this point, I would like to turn this over to my colleagues, Dr. Shari Bolen, as well as Rita Horwitz from Better Health Partnership.
I'm hoping you can hear me okay. So I am Rita Horwitz, and I'm the Director of Business Development and Operations for Better Health Partnership, and the chairperson of the anchor organization leading the improvement of the chronic disease management for HIP-Cuyahoga. Next slide, please. And a great big thank you to all of our subcommittee members. Again, I think, and Heidi mentioned in her talk as well, we've just had a growing membership as time has gone on. As you can see, we have quite a nice cross-section of partners working with us on this work, from medical professional associations to health departments, community organizations, higher education, local business, healthcare organizations, health insurance companies, and foundations, and more. And we are always open and willing to have more folks join us after you hear today's webinar. If you're interested, certainly we'd love to have you. So the Chronic Disease Management Subcommittee Goals, one, we decided to take a focus on cardiovascular disease because chronic disease is a massive thing to tackle. Selected cardiovascular disease because it's still the #1 leading cause of death in Cuyahoga County, the state of Ohio, and the nation. Oftentimes the underlying cause is untreated or undertreated high blood pressure that leads to heart attacks and strokes. We know that 1 in 3 Americans has high blood pressure, and we also know that people with fewer resources, like access to healthy food or to good health care, have more complications and deaths, and they live sicker lives and they die earlier. And we know it does not have to be this way. So our subcommittee came up with 3 goals that we've been working on for the past couple of years. The first one is to develop campaign messaging for the most vulnerable populations to help them increase their awareness of high blood pressure and about it. And we're really trying to make a push here for self-activation, self-management of their conditions. The second goal is to implement a best practice program for high blood pressure management in clinics that are serving the most vulnerable populations, and you'll hear more about that from Dr. Shari Bolen shortly. The third goal is to connect clinical providers to community resources to better manage high blood pressure and improve outcomes. So things like resources that are in with healthy eating or active living or chronic disease self-management programs. And again, we have some work in progress along these lines already. Next slide, please. So the first goal I mentioned was around our campaign messaging and raising awareness. And so one of what you're seeing here is an advertisement that went out over the past year, and it was related to adults with high blood pressure and just notifying, hey, 1 in 3 has high blood pressure, and the importance of knowing what your blood pressure is, checking it, changing it by getting active, eating healthy, and controlling it and keeping it at a safe level. This was related very much to the Million Hearts campaign advertising that has gone on with the American Heart Association. And these ads ran in a variety of neighborhoods with disadvantaged populations, on buses, and in other local venues. Slide, please. So I want to introduce Dr. Shari Bolen, who will take you through what our second goal was all about, which is implementing best practices in the clinics serving most vulnerable populations. And she will tell you about our work that was fortunately funded by the CDC in the REACH initiative, which stands for Racial and Ethnic Approaches to Community Health. So Dr. Bolen?
Thanks, Rita. Yes, so the Cuyahoga County Board of Public Health was funded through the Centers of Disease Control with this grant, and it really accelerated some of the work done in our subcommittee and also the Healthy Eating and Active Living subcommittee. So you'll hear more about that when they speak as well. So I'm going to talk about how that helped us sort of with some of the goals that Rita just mentioned. So these were specifically listed under our REACH activities, but as you can see, a lot of them hit the goals that we were trying to reach under our committee, which, so the first one is really helping clinics that are serving these vulnerable populations to provide high quality care and blood pressure management. And that's through sharing a known best practice that's worked to improve blood pressure control. The second is really as part of that best practice to provide communication training to our clinic teams. And that's really around building trusting relationships with patients so that we're more likely to have that connection and improve their health outcomes. The third is training community members to lead workshops on managing chronic illness, and HIP-Cuyahoga Partners has been a lead in doing that as part of our subcommittee. We've been working, number 4, to really help link these clinics that are serving these vulnerable populations to neighborhood resources for healthy eating and active living. And you'll hear more about that under the Healthy Eating Active Living subcommittee. But as those resources are growing, how do we link our patients to those, and then and our community to those, and then self-management as those become more available within the community, how do we link to workshops around that? And the fifth is really to increase awareness of high blood pressure importance and the importance of self-management workshops via advertising, which you'll hear more about later. So I'm just going to talk about some early successes that we've seen, and we're still pretty early on, but one of the things that we've been trying to do and that we've been able to do in the last year and a half is really train over 30 self-management workshop leaders in these neighborhoods to help lead self-management workshops. We've established a process to refer patients at several of the clinics that are serving these populations to the workshops in their neighborhoods. And so far, we've held 2 workshops already and plan to do many more next year to look at, and the ones that we've held, those 2 self-management workshops that we've held, just the early survey data from those participants suggest improvements in quality of life, depression scores, and pain. And then in terms of blood pressure control, as we mentioned, we're working on implementing this hypertension best practice or a management program for hypertension within the eventually 9 clinics. So far we're working in 6 clinics, and we have 3 that we're going to be working with over the next year. And all those clinical care teams have received our communication training, so we really focus on empathy, health literacy, and unconscious or implicit bias, and how to address those in the clinic setting to improve the relationships with patients. And then the third bullet here is really speaking to the 4 clinics which have already finished implementing this blood pressure management program, and we've seen that they've improved their blood pressure control from 3 to 17 percentage points, which is very large for blood pressure control, which really translates to about 460 more patients that are under good blood pressure control. So we're really excited about some of this early work and hope to continue to see additional patients and improvements as we continue working with these clinics and engage other clinics as well. So I'm going to turn this back over to Rita to just briefly talk about sort of what's next and what's happening.
So where the subcommittee wants to go next is to really start to focus strongly on community engagement. You heard a lot from the other 2 subcommittees that presented. They have strong policy agendas and have been doing a lot of work in that space. And our group, I think, is going to be pretty strong in this community engagement space, which is new for everybody. I think we're still trying to get our arms around sort of what does this mean and what could this look like and what's the vision and how should we go about approaching this. The first thing is that we want to enhance our campaign messaging. Some new ads are coming that the community themselves, some of the folks in the community and different focus groups told us what they would like to see improved with the messages, and Martha Halko will be speaking to that a little bit later in today's webinar. And then the second way that we're starting to examine or explore what else is out there and the ways that we can improve blood pressure control through better community engagement, the first thing we've been looking into are the notion of blood pressure screenings in different organizations throughout the community. And interestingly, we know that there is some local activity afoot where blood pressure screenings are done in local barbershops. Certainly we've looked into a little bit of what's going on with Stay Well, where these health screenings are happening in Hunger Network food centers. We know the American Heart Association has some integrated screenings in the community. Everybody doing some great work in this space, and so we're starting to say, how can we leverage all this work, build upon it, and maybe better coordinate it and integrate it, and even if we could link it back to getting these folks who are screened to primary care providers and be able to measure and evaluate the impact as we get further integrated in the community would be certainly something we're looking to do in the future. I've included a web link here for you, which I would encourage everybody to watch. It is amazing. It is a TED Talk with this fellow, Joseph Ravenel, and he talks about the work that is going on, particularly oriented around Black men who die from heart strokes more than anything else, stemming from uncontrolled high blood pressure. And the work that's going on in the barbershops, and he really speaks about sort of this shared vision for creating the opportunity and empowerment to make a difference in the community, and he talks about it relative to the intersection of health and haircuts. So I'd really recommend you take 10 minutes to watch this TED Talk. It's very, very well done. The other thing we're looking at is how can we get more faith-based organizations involved, perhaps in blood pressure screenings, health screenings, to improve the management of chronic disease. We're well aware of Evibase's work in this space with chronic disease self-management programs in the faith-based community and some of the successes they've had. So again, looking to build on things that are already out there and improve upon them. And finally, we definitely want to continue to involve the business community in this work. Lots of local businesses have workplaces and employees and families, and certainly this is another way to think about community engagement. we recently highlighted HIP-Cuyahoga's work at the Nestle Stakeholder Convening event on June 17th, which is part of the Institute of Medicine's CEO Innovation Roundtable with a focus on chronic disease and in particular obesity. So we hope that we can continue to work with that group and have them leverage HIP-Cuyahoga's work as a foundation that they can build upon as well. Next slide, please. I will turn it over at this point then to our Healthy Eating and Active Living Subcommittee with Erika.
Great. Thanks, Rita. This is Erika Trapl. I'm at the Prevention Research Center for Healthy Neighborhoods at Case Western Reserve University, and we serve as the anchor for the Healthy Eating and Active Living Subcommittee. Next slide. So just as a reminder of why we have healthy eating and active living as part of our priority areas, we know that we have issues around obesity, but more importantly, we have issues around food access and really having access to transportation, safe places to be active, and places to purchase healthy foods. So that's really the foundation for the work that our subcommittee has been working on. Next slide, please. So I'm going to be providing you some updates on what our solutions have been and where those have gone. And I'm going to kind of divide this into two sets of updates. The first set of updates will really focus around food access issues and food access work that the subcommittee has taken on. And the second half will focus on more of the active living solutions and strategies that we're engaged in. So we'll start with healthy food retail. I'll talk a little bit about FAIR, which is the Food Access Raises Everyone planning process, which some of you hopefully have heard about through our HIP-Cuyahoga newsletters, and then the addition of farm to school and farm to institution through some new grants. We'll also talk about shared use, and then I will ask Barb Clint to talk with us about complete streets policies. Next slide, please. So the first slide is about healthy food retail, and we just want to say, yay, it's happening. These are some pictures from one of the stores in East Cleveland that's been one of our partners in joining our healthy food retail initiative. And I didn't do the pictures quite right, but you can see the bottom half of the logo. It's actually, the full sign says good food here, and so hopefully if you're traveling through some of our neighborhoods and stopping into some of the corner stores, you'll start to see this signage at stores that have become a partner store. So as Rita and Shari mentioned, HIP-Cuyahoga received a REACH grant, which is Racial and Ethnic Approaches to Community Health, which has really supported a lot of the work that the HEAL subcommittee has been able to do. So we've been very lucky to be funded, actually not just by one REACH grant through HIP-Cuyahoga, but also through a second REACH grant received by the YMCA, which Barb will talk more about. One of those key strategies was looking at how to increase healthy food access. And so we approached small stores to begin to sell more produce and fresh and healthy foods. It's been a long time coming, but after probably 6 to 8 months, maybe close to a year now, we've been refining a framework for engaging stores and have a very nice, well-developed plan that all of the committee has really been actively engaged in developing, as well as lots of input from residents in what they want to see at these stores, which stores they'd like to see us engaging with, and what kinds of foods should be sold at these stores. So to date, we've been predominantly working in the 7 neighborhoods of REACH, which include East Cleveland, Glenville, South Collinwood, Central, St. Clair Superior, Huff, and Union Miles. And we also have been partnering with Tremont West Development Corporation, who has been very engaged in their healthy retail work, as well as the Creating Healthy Communities group at the Cuyahoga County Board of Health. So to date, we have 7 stores in our 7 REACH neighborhoods, including support from Creating Healthy Communities, 5 active stores in Tremont, and we're hoping to bring on several more in our current REACH neighborhoods and actively looking for ways to expand this to the other neighborhoods that are not supported by REACH. So that's part of the work of the subcommittee. in addition to just putting the food out there, the next step is really engaging other partners to really make this a wanted asset in the community. So we're looking at ways to bring nutrition education, cooking demonstrations, and other supportive programming around the stores to really increase utilization within the neighborhoods and make these a place to shop. Next slide, please. At our last webinar and over some of our past communications, I've mentioned that we've been lucky to engage the technical assistance of the Food Trust, which is an organization that promotes healthy food access out of Philadelphia. And we had an opportunity to work together with them and come together through some funding through the St. Luke's Foundation to really talk about how to expand this work beyond healthy food retail and really into a broader healthy food access plan. And so through our subcommittee, we've helped to lead FAIR, which is Food Access Raises Everyone. It's been a food access, a comprehensive food access planning process. We had a very large community planning event held in April 2016, and our goal is to produce a Cuyahoga County food access plan by September of this year to the community. This really formalizes the other food access work as components of HEAL. So initially we were just around healthy food retail, but now we've been able to really broaden the perspective of the subcommittee, which brings in so many other great partners and allows us to really advance some of our food access work. So if you go to the next slide, one of our newest work groups within the subcommittee is a group around farm to school. And this was really motivated by more recent funding received by the Cuyahoga County Board of Health through the USDA Farm to School grant. And they were the only one in the state of Ohio to actually receive this funding. And so through this grant, they will be working on developing producers and readying schools to buy from local producers to support county-wide farm to school expansion. Again, receiving technical assistance from the Food Trust. So it's been great to have the Food Trust as a partner as we figure out what our comprehensive plan is and how we bring all of these pieces together so that we're working in collaboration to advance healthy food access. We formally added Farm to School as a component of HEAL in spring of 2016. And this group has just started to form following FAIR and will meet on an ad hoc basis as needed. Next slide, please. I also want to highlight our work with shared use. Again, through funds received from the REACH grant, we were able to bring Change Lab Solutions, a national technical assistance provider, to provide a shared use agreement training in September of 2015. We brought stakeholders, community organizations, residents together to talk about what shared use looks like. And shared use is a way to have organizations who have space share that space for purposes of physical activity or community utilization, so that reduces the resources needed by those outside entities and really increases utilization of those assets that already exist within communities. As a part of that project, we created the Shared Use Agreement Resource Guide, which is available for download on the HIP-Cuyahoga.org website, and we encourage everyone to use that. It has lots of great information. So if you are interested in your organization creating a shared use agreement, if you'd like to advocate to other organizations for shared use agreements, that's a great resource to use. To date, we have, again, been working in the 7 REACH neighborhoods to really advance shared use agreements. And we have 9 that are drafted and just waiting signature. And I assure you all that everyone on this call will probably hear the cheer from our team once those are signed. We're very excited to have that. And as Shari and Rita both alluded to earlier, the benefit of this REACH process and thinking collaboratively is that we are taking these shared use sites and the healthy retail sites and putting them together at a comprehensive resource to be shared in the clinical setting, so that we're really sharing this information throughout the community. Next slide, please. All right, and at this point I'm going to hand it off to Barb so she can tell you more about the Complete Streets policies and the work that's happening in this area.
In terms of Complete Streets, much of the work that's underway is currently concentrated in the city of Cleveland and is focused around the Midway Protected Bike Boulevard Network proposal, which is a vision to convert 80 to 100 miles of overly wide streets with low traffic volumes in the city of Cleveland into physically buffered bike facilities. Next slide, please. In essence, the objective is converting our seas of very uninviting concrete that we see all over the city of Cleveland into protected bike boulevards with low stress for riders of all ages. It's the 8 to 80 approach to active transportation. And what's envisioned is, a systems-wide approach starting within the city of Cleveland, but ultimately expanding out into the surrounding suburbs. Some of the thinking that's reflected in the Midway study that is underway was also integrated in the East Side Greenway plans that were completed about a year ago. So we expect this is going to be a regional approach to the effort of calming our streets and inviting a wider array of users to them. Next slide, please. In terms of the equity questions that were mentioned earlier, it was critical to the folks who first were working on the concept of the Midway to take into account that on average 30% of Cleveland households do not have access to a private automobile. It's a small map up on your screen, but the darker the red, the higher the concentration of households who do not have access to a private car. And when you look at that map and look at the adjacent map of Cleveland's historic streetcar network, you see the high concentrations of carless households very much correspond to the old streetcar neighborhoods. They've always been transit-reliant neighborhoods. So, and because of that, they have a lot of opportunity for conversion to this new protected bike facility because there's additional width on those corridors. Next slide, please. The question that informed a lot of the early conversations for this Midway proposal was, for whom are we designing our cities? We recognize, in addition to the households without access to cars, the way the city of Cleveland is currently configured, and this is true in a lot of surrounding suburbs as well, it's a very car-oriented environment. It's difficult for kids to safely move around, to get to school, to get to a rec center. It's increasingly difficult for an aging population to get to a grocery store, to move around. Our streets are very wide. That lends to cars speeding because of the excess width. That's partly what's driving this. We're in a new office configuration, a shared office configuration, and my colleagues don't know I'm on speaker. Okay, next slide, please. As I mentioned, much of this Complete Streets work is concentrated in the city of Cleveland proper, although the county has had an effort underway going back a couple of years now, working through the county engineer's office and, I'm blanking on the second office. In any case, they're trying at a county, community by community level to get different suburban jurisdictions to adopt complete streets policies. Currently, there's efforts actively underway in Cleveland Heights and to lesser active but moving in the right direction degree in South Euclid. So this is going to be beyond the city of Cleveland. And coming up as part of this Midway study, there's a planning process underway that the local match for which was supported by the REACH dollars that the YMCA had secured. And that enabled the City of Cleveland's planning department to secure a larger grant through NOACA to conduct a study of the entire street network in the City of Cleveland to determine the feasibility of a Midway protected bike boulevard configuration. So where the planning process is at about a midpoint. There's been a series of both Steering Committee and Technical Advisory Committee meetings going on over the last several months, and the first opportunity for the public to weigh in and see where the plan stands is coming up this week. There's a noontime meeting coming up Wednesday at the downtown library, and an evening meeting on Wednesday at Fairhill Partners from 6 to 8. And there's a second evening meeting this coming Thursday, June 30th, at the Zone Rec Center, also from 6 to 8. This effort will be wrapping up by the end of this year. So while the planning and engineering work, preliminary engineering work is underway, there's also work underway looking at how the city would pay for this, or how the city, in partnership with other interested parties, would pay for such a network. So you'll be hearing more on that in the upcoming months. Next slide, please. Or that may be the last slide. Okay, let me add a couple of things that weren't on a slide. Other related work to promote active transportation in Cleveland and Greater Cleveland is a Bike Cleveland-led ad campaign called We Are All Drivers. It was launched last year. It's been relaunched with some additional high-profile partners, including Sandy Alomar, doing some of the messaging in both English and in Spanish. So be on the lookout for that. It's a multimedia public education campaign. We are also literally days away from the launch of Bike Share in downtown Cleveland and University Circle areas. It's going to begin with 100 bikes that will be on the road in time for the RNC, as much of everything is, and it's going to expand to 250 bikes by the end of July, 1st of August. And what's interesting about the Bike Share approach in Cleveland is it will have the most equitable system of any system in the country. Efforts are underway to finalize how we can link the bike share system to users who don't have access to credit cards, which is usually necessary to access systems like this. And the thinking is this will be accomplished through the library, where you could go to your local neighborhood library, get a library card if you don't have one, and for a very, very modest fee, be able to pay and be a member and enable you to use the bike share system. So we're really excited about the library stepping up and offering to work with us on that. There's also a lot of work that's just wrapped up and it's moving from the planning to the implementation phase around safe routes to school. And this tracks very much with Complete Streets practices, because we have to be designing for the users 8 to 80, and that includes our kids trying to get to and from school. So the plan has been completed, and the first implementation activities have been identified, and funding is has been sought and will be known about soon to move that forward. There's also a lot of work underway to communicate to the broader public how things in all these categories are progressing. In partnership with the CASE PRC as well as the Kent Cleveland Urban Design Collaborative, a bike data dashboard that will be that will reside on the page for on the website and Facebook page for Bike Cleveland. It's been developed and is very, very close to going live. The data's been collected, and the PRC team working with the designer to populate some test screens and get that up and running. But that should be operational very shortly. I guess the final couple of things. We have, in the last year, noticed a great deal of growth among bike clubs, and we've known from efforts underway around other parts of the country that social supports of that sort, especially in African American, Hispanic neighborhoods, are really important. So we now have a Cleveland chapter of Black Girls Do Ride, and there's also been a lot of growth in another local club called the All Out Riders. So that's something that's heightening awareness about active transportation as a concept, and also building more support for these improved facilities. So final thing I'll say is, as a companion piece to the formal Midway planning process, there will continue to be over the summer and fall a series of Midway meetups that we're planning with neighborhood-based organizations to just further introduce the background and the potential for this Midway protected bike facility. So that's all. Oh, that's all I have. Thank you.
Thank you, Barb. This is Martha Halko. I'm going to take the last 10 minutes to provide an overview of some of the efforts that we have as a consortium as a whole. So I'm going to talk about the work of our 2 work groups. So in addition to the 4 key priority subcommittees, we have 2 very active work groups, the Communications and Community Engagement Work Group and the Shared Measurement and Evaluation Work Group. And I'll also be talking about some of our efforts around health and equity in all policies, which for those of you who are not familiar with that terminology, it refers to assuring that health and opportunity for all are considered in our decision-making processes, whether they be institutional, organizational policies, systems, or institutions and organizations. And then finally, I'll be talking about our efforts to support our work long-term and work that we've done as a steering committee and a subset of the steering committee to sustain our efforts. So looking at communications first, we have a communications and community engagement work group that I chair along with support from several staff here, namely Ann Stahlhaber and many of our other members of our Cuyahoga County Board of Health team. And then we also have many folks that are participating from other organizations and have been very supportive in shaping our marketing and communications work. We've also engaged consultants to help us over the course of the last several years. We've worked with Berkeley Media Studies Group, actually out of Berkeley, California. They are an organization that conducts research and they provide technical assistance and training, looking at how mass media influences, in essence, the public health narrative and public health messaging and social issues. So they've been really critical in helping us really frame and shape our messaging through that lens of equity. And they've helped us work with the framing that we've used consistently over the last several years, which is what are the problems, what problems are we addressing, why does it matter, which brings into play the value conversation. Really, why does this matter? Why is this important to us and others? And what are the solutions that we are implementing? And then we've also worked with Conceptual Geniuses. They are a communications and marketing firm from Washington, D.C. They've worked with us on our brand refresh, so we've unveiled a new logo, new color schemes. They've helped us develop the Health Matters Here logo that is displayed on this slide. They've helped us redesign our website and design materials that, including the Community Health Improvement Plan, and then materials that fall in that same design for consistency. And they've also developed our ad campaigns in partnership with our, with our residents and partnership members. And then we're also working with Radio 1 Cleveland. Really, our focus here is on community engagement. We began our relationship with Radio 1 last year, and they worked with us to develop public service announcements. This year they'll be working with us again. We'll be broadcasting live from select community events and festivals to engage the community in our efforts, and also to help support a community event we'll be hosting, which I'll talk about momentarily. They'll also be working with us on what's termed geofencing, which in a particular area we can work maybe in anywhere from a half-mile to a 5-mile radius within communities. It works with electronic devices such as computers and smartphones, and when residents or community members enter that space, banner ads would appear on certain apps on folks' devices. And those messages and ads are consistent with our ad campaigns that we've developed. So here's just a sampling of the upcoming ad campaigns. These are ads that will initially appear through advertising vehicles and RTA in our target communities in the city of Cleveland and East Cleveland areas predominantly. And these are the healthy eating, active living ads that support what Erika Trapl shared earlier, highlighting the Good Food Here logo, and encourages residents to just look for those ads and to frequent their local stores and purchase those healthy items in the stores that are now carrying those items. So the top ad is an interior bus ad, and the lower ad is an exterior bus ad. So as you travel through those areas of the city beginning in early July, you may begin to start see those ads. And then for the chronic disease management ads, again, we're focused on high blood pressure. We took a more novel approach this time in our chronic disease messaging, and these ads were actually tested with our resident partners and through many of our partners through the subcommittees themselves. And we found that this message related to how high blood pressure impacts your sex life was obviously very powerful and attention-getting. And so we'll see how effective that ends up being. But that's the focus of the top ad, and that will be an interior bus ad. And then the lower bus ad will be an exterior bus ad, and really speaks to the fact that typically men are not as good at getting themselves to a healthcare provider, and really encourages men to be more active in seeing a healthcare provider and having their blood pressure checked, and then working with their healthcare provider to control and manage their blood pressure. So again, our work group currently focuses both on communications and community engagement, and this is a product that actually Ann Stahlhaber created with input from many. You may actually recognize some of the faces in the heart in the center of this flyer, but these will be, or may have already begun to be disseminated, advertising and promoting our upcoming Community Day. That was generously supported by St. Luke's Foundation. We had our first annual Community Day last year, and this is our second annual Community Day. And we're fortunate to have been able to engage community residents much more deeply into the planning and development of this Community Day. So it'll be at Friendly Inn Settlement on September 10th. With much resident involvement. We'll be highlighting community leaders and organizations that have contributed to our efforts. There'll be networking opportunities, there'll be community resources and activities for kids as well. So the other work group that we support here at the Cuyahoga County Board of Health is the Shared Measurement and Evaluation Work Group. That work group is chaired by Chris Kippes. He's the Director of Epidemiology, Surveillance, and Informatics here at the Board of Health. Again, this work group as well consists of many partners from multiple organizations that provide critical input and feedback to how we should move forward. Shared measurement and evaluation right now is an important phase of our work. So as many of you are aware, we released and distributed our Community Health Improvement Plan in just about a year ago. It was June of 2015. And most of the action plans that we had developed were 2-year action plans. So we're now at that phase where, as you heard from the other presenters, where in some cases new work has been attached to the work of each of these subcommittees. We have seen maybe a further development or modification of some of the original objectives. For instance, in response to the REACH grant that we secured. And we've been fortunate because through the REACH grant we've had very fruitful evaluation, as had been requested by the Center for Disease Control and has been required for us, and that was well resourced. But other aspects of our work is not as comprehensively evaluated, and the other challenges is that they're not all well connected. So really our focus now, coming up to a year after the release of our Community Health Improvement Plan, is to really put together a comprehensive evaluation plan. And as many of you can imagine, as we share our work, that's a complex effort to undertake. So, some of the initial steps we'll have to undertake are really to revisit our action plans, and begin to integrate and reflect some of the new work streams, or perhaps some of the work streams that have been connected but perhaps funded through another funding source. So, an example would be the work that is being supported through the Build Health Challenge grant. Being able to leverage and integrate some of the evaluation that's already happening in a grant project such as that, and then connecting it to an overall evaluation plan so that we can really fruitfully understand the progress and the impact that we're having. So that would require us to update some of our objectives and create new timelines, and completing and or updating performance and outcome measures. So this is something that we are embarking on and seeking some technical support, especially from the perspective of the fact that our work is not just traditional public health evaluation. As Heidi talked about very early in the webinar, we've taken a very strong collective impact approach, and we have also focused on complex social issues. So we need to expand our capacity and knowledge base as well to be able to measure our impact on systems, structures, organizations, and policies, even looking at the performance and the effectiveness and the efficiency of our partnership itself. So those are all considerations as we move forward. This is a piece that we will need to identify resources for, so that work will be underway. But regardless, we are committed to providing some type of outcomes and success report. As we heard from the presenters, Dr. Shari Bolen, there are outcomes and there are successes. We have shared success stories, and those are available on our website, and we're generating 2 additional success stories. We'll have the results of the readiness assessment, so there will be successes to report. Whether we will have a comprehensive evaluation plan by then is questionable, but we may have perhaps a first phase of a comprehensive evaluation plan by December. But I highlight December 2016 because we will be convening the full consortium early in December of 2016. So, we will follow up with specific details related to dates, times, and locations. But that's the time frame that we're looking at, and should be at least providing save the date information soon so that everybody can have that on their calendars. But a focus will be to be able to spend time on the outcomes and successes tied to our work. So as Heidi mentioned earlier, health and equity in all policies, along with community engagement and collective impact, are 3 key approaches that we've really invested a lot of time and energy in. So we've dove in a little deeper into health and equity in all policies and really established an early set of action steps. At the steering committee level, we've begun to talk about policy priorities and development of policy goals. Really embedded into the subcommittee work of all 4 of our subcommittee are various levels of system, or policy change level work. As you heard from Dr. Heidi Gullett, the Clinical and Public Health Subcommittee has policy efforts linked to the state, and in some instances we may have policy level work tied to more local systems or community level activities. So we're looking to really begin to shape what those policy priorities are and to refine our policy goals and begin to formulate the development of a policy agenda. There's certainly low-hanging fruit there, and we recognize that policies differ in the sense that we have much more control over select policies, like you heard from Erika Trapl, around shared use policies, which are tied to specific facilities agreeing to open up their sites for perhaps physical activity or other health programming. That's different and less complex than, for example, if we decide as a partnership to support, for example, minimum wage policy. Clearly, far more reaching impacts, and we really need to understand the context and the role that HIP-Cuyahoga can play in those types of policy efforts. So this is the work that we are moving through now, and we'll be certainly engaging the broader consortium in those efforts. In the short term, we are building on our initial communications efforts with Berkeley Media Studies Group. We are actually hosting a communications workshop in early August for a subset of members from each of our 4 subcommittees. Many of those attendees have been identified. And really that allows us to capitalize on policy or systems level work that's already active in each of our subcommittees, and it will allow us to better refine our policy communications capacity, to refine our messaging, bring new allies to the table perhaps, and then also to jumpstart the development of policy briefs on select policies that are identified for that workshop. And then finally in the policy realm, we will also be hosting 2 key decision maker and policymaker caucuses. As you recall, some of you may recall, we hosted a key decision maker and policymaker caucus back in 2015, and this would allow us to more broadly engage key decision makers and policymakers in the policy agenda and the policy priorities that we identify. And those events are scheduled for first quarter of 2017 and first quarter of 2018. Specific dates, etc., will be still announced, but we're looking forward for the opportunity to further engage our local policy and decision makers in our efforts. And then finally, we have really over the last year really began to focus more on resources and sustainability from the perspective of the fact that we are really committed to maintaining our partnership long term. There's a lot of research and evidence in the collective impact universe that really speaks to the fact that sort of a strong, effective, sort of a trusting partnership can have a greater impact on, health outcomes and social issues than a singular program in of itself. So, building on that philosophy, we're very committed to maintaining our infrastructure and really supporting the backbone of this effort, which includes the Board of Health as the backbone organization, but also our co-chairs and the 6 anchor organizations that are really providing extensive in-kind support to date to support the work of the subcommittees and actively participate in various webinars such as this, events, and regular steering committee meetings. So we're extremely appreciative of everyone's commitment and involvement. We're also very appreciative of the funding partners, and we call them funding partners because the majority of our funders have actually, been very engaged in our efforts and been active members of either HIP-Cuyahoga broadly or even more directly in the work of the steering committee. And those funding partners include St. Luke's Foundation of Cleveland, Mount Sinai Healthcare Foundation. We've had past funding from the National Association of County and City Health Officials, the George Gunn Foundation, and again, I've highlighted or bold-faced the most recent funding partners in St. Luke's Foundation, and then the Center of Disease Control and Prevention has provided us resources through the Racial and Ethnic Approaches for Community Health grant. So we've actually formulated an ad hoc group, which was an offshoot of our steering committee to really put together a resource and sustainability plan that we shared recently in March with a philanthropy and private sector forum that brought together, as Rita mentioned, private sector partners as well as regional philanthropy organizations to begin to discuss how do we build a long-term sustained culture of health in our region that really leverages and builds on our 3 key approaches that we've highlighted throughout. So, I mean, one real positive outcome from this partnership is a true testament to the partnership is the fact that we've been able to leverage over $750,000 in resources to really expand on the work of each of the subcommittees. So again, please stay tuned. We'll be circulating soon a save the date for an early December 2016 consortium meeting date and time and location. So at this stage, we'd like to open it up for questions. All our speakers are available to answer questions, so you can provide.
The conference has been muted.
We will unmute.
The conference has been unmuted.
You could also generate your questions through
the one you emailed Diana about.
So if I could just have everybody.
The conference has been muted.
We will be unmuting. We unmuted briefly, but if folks could recognize that we can hear everybody's conversations for the question and answer period, you can either generate your questions through the chat box or that would be preferable, but if you would like to do the hand raise function, then we can unmute you specifically, I think would be the most productive way for us to access everybody. Yeah. So if there's any questions, please feel free to, again, right now to enter them in the chat or to use the hand raise function. So again, if anybody has a question, we'll wait another minute here just to assure, because we have about 4 minutes left for any questions. Although we will have contact information, and I will advance to that slide. So if you have a particular question on this slide here, you can see the email contacts for everybody, and you can access folks directly. So one question has just come in from Jody Mitchell. Do you have a sample newsletter articles that organizations can use in their communications to spread the word about HIP-C? We actually don't have a newsletter, but we have a new one-page flyer that has been created. It's a one-page brochure, well, it's actually 4-sided. So we just completed that, and we'll be printing it, and we can also post that to the website. It's kind of hot off the presses. So we thank you, Jody, because that was something that was missing for us, and we will make that available on the website for download.
This is Heidi. I also want to just add that if you have a specific need related to one of the subcommittees where you feel like some key talking points would be very useful in your interactions with others to kind of onboard them to either HIP-Cuyahoga in general or a specific subcommittee area, please reach out to the co-chairs for that subcommittee, because I know in ours we've talked about specific key talking points. So that's something that we also want to be available to you as well. I'm going to turn it over to Chris to answer the next question. Come on.
Yes, I see there's a question about the life expectancy project that Virginia Commonwealth put together. And Kim's question is in relationship to how that compares to the 2009 local efforts. The VCU analysis is much different from the standpoint that they used a different period of time, so they used a decade's worth of information to look at life expectancy. We used 3-year time frames. They used, I believe, 2000 through 2009 or 2001 through 2010. They also analyzed the information at the zip code level, where the work that was done in 2009 and subsequent years analyzed the life expectancy data at the census tract as well as the community or municipality level. And then finally, the VCU analysis was restricted to a 5-mile viewing area for the map that you saw produced. So because of all the methodological differences, it's really difficult to compare actual areas within the county between the earlier work and the continued work through HIP-C with respect to the most recent map. That being said, the important take-home message is, regardless of the methodology and the time frame used, you see this decade plus of difference in life expectancy between the different communities throughout Cuyahoga County, and that really underscores the unfairness and the injustices that exist, and why we need to continue to work hard to make corrections in that. So thank you. You're welcome, Kim.
Okay, are there any additional questions? We're just at 2:30. I don't see any hands raised or any additional questions on the chat. So I will assume that there are no additional questions. But again, you have the contact information of steering committee co-chairs, each of the subcommittees, contact information from backbone organization staff. So feel free to reach out to all those persons. So I just want to thank all the presenters today for sharing their updates. And definitely I hope that all of you will continue to be involved and also spread the word to your networks about HIP-Cuyahoga.
We'll make the slides available.
And we will make the slides available on the HIP-Cuyahoga website. And again, that's hipcuyahoga.org. Thank you for your time.